Hello, everybody. This is Allie Orwig with the Indiana Rural Health Association. We appreciate you joining us today. A couple quick housekeeping items before I turn it over to Cody. This is a webinar format today, so you don't have the audio option of asking questions, but we do have a Q&A and chat function available to you. I'm going to send everyone a quick chat right now so you see how that works. During the presentation, if you would like, you are welcome to send in a chat, or at the end of the presentation, we will check the Q&A option to answer any questions that may have been submitted that way. So once again, we do appreciate everybody's time today. We are recording the session, so if you aren't able to join us for the full presentation, we will have that available on our YouTube channel after the webinar has completed. So without further ado, I'm going to go ahead and turn it over to my colleague, Cody Mullen.
Good afternoon, everyone, and welcome to today's Lunch and Learn. And thank you so much for taking some time today to join us as we discuss identifying grant opportunities for substance and opioid use disorder. Before we get started, a couple disclosures that we say. So we will be referencing a couple of different federal grants during today's presentation that IRHA has. Pardon me. All programs mentioned are funded by the Health Resources and Services of Administration. There are no interests of conflicts that we need to disclose, and any comments are those of me and or the Indiana Rural Health Association and should not be applied as endorsements from HRSA, HHS, or the overall U.S. government. So our agenda today, I'm going to give a very brief overview of the Indiana Rural Health Association, the Indiana Rural Opioid Consortium, INROC, as well as a little bit of high-level data related to the opioid and substance use crisis sweeping across our state. And then the meat of today's Lunch and Learn will be an overview of the grant anatomy, where we really get into each component of a grant and what goes into that. I have a lot of guiding questions for you to be thinking about as you prepare for your grant writing efforts. And then also an overview of grant identification and different spots to look at for funding. So the Indiana Rural Health Association, our mission is in 5 main areas, is to increase leadership, education, advocacy, collaboration, and resource development across rural Indiana to support the growth of rural health and ensuring that there is rural health. Our efforts are far-reaching, all the way from public health and primary prevention related to like smoking cessation, the work of INROC and opioid use reduction, all the way to supporting hospitals and Medicare billing and advanced payment models and adoption to those in rural facilities. So as we look at some high-level data, as we get ready to talk a little bit more about substance use disorder and opioid use disorder, we got to remember that Indiana is one of 20 states that are statistically higher than the national average in 2017. And that trend is holding true moving forward. So really our area of the country, the Midwest, is a high area, as well as a few down in the South and then the upper Northeast. So we do see a significant higher prevalence and incidence of substance use disorder and opioid use disorder. That also carries over to a higher rate of deaths in our communities. But we also are seeing over time that the ratio of drug overdoses and opioid-involved overdoses that are leading to death is changing. So in 2017, 2018, we saw about 2/3 of all deaths involved were related to an opioid induced death. But if we go further back to like 2013, 2014, we saw that it was really only 1 in 3 or 2 in 5 deaths in there. We can also see, though, that our overall all deaths had been rising from 2013 to 2017, including also for opioids. So that difference was really related to the opioid overdoses, as we still had general drug deaths. We did see that in 2018, the bending of that curve for the first time, and a decrease in deaths from a lot of the efforts that a lot of the people listening to this or on today's call have been involved with. So that's been very positive. We also know that our drug epidemic has really been seen over 3 unique waves. that have been related to that as we've seen increases in the epidemiological profile. So wave one really happened around 2001, and we started to see a rise in prescription opioid overdose deaths. I mean, we can see that that increase occurred really, like I said, in 2001, but in 2007 to 2010 is really when we started to see that increase. We then saw in about 2011, 2012, when we saw there on the green line that rise in heroin deaths. So as we started to notice a higher prescribing patterns of opioids through prescription drugs in our primary care settings and specialty care settings, as we started to reduce those and decrease the supply of opioids through prescription drugs on the street, we saw that there's an increase in the utilization of heroin because individuals who did have an addiction related to opioids were transitioning from one substance to another to still fulfill that addiction. But we knew that that was not, that was still a dangerous, if not more dangerous methodology because heroin could have been laced with fentanyl or carfentanil. We saw some spikes in overdoses related to those. And we've seen heroin grow significantly, exponentially from about 2011 to 2012. Then recently in 2015, 2016 was really when we started to see that synthetic opioids, that lacing of the heroin with fentanyl and carfentanil, massive deaths that occurred there. So we saw that spike. And then this graph doesn't show up, but we know that starting about 2017, 2018, we started seeing a spike from methamphetamines and overdoses related to methamphetamines and other stimulants. So we're seeing a bi or polysubstance epidemic and different waves in that epidemic. So as we're talking about grant writing here moving forward, it's just something to keep in mind that just because you're writing for an opioid or prescription drug grant right now doesn't mean during a 3, 4, or 5-year funding period, you may not have to transition to a different substance as the epidemiological profiles show that. So I know we have a lot of people on the call, but just to show some high-level state statistics at the county level. So the counties, the darker the color, the higher the deaths or drug poisonings leading to death in those communities in 2018. So we saw that our southeast portion of the state was the most highly affected. Our central portion of the state, especially around Marion County, and the donut counties around Marion County were high, and then also to the north. But we have been very, a great positive to all of this is we have seen a decrease in overdose deaths, but we are seeing a lot of non-fatal emergency department visits related to an opioid overdose. Again, it's that southeast portion of the state that has the highest prevalence. But if you look and notice, pretty much the whole state glows with a significant rate of non-fatal emergency department visits. And we also know we complicate that by work from Bowen Center with the IU School of Medicine, looking at where are our providers who are licensed to provide MAT. The darker the red, the better on this graph. So we know that up in Lake and Allen and Marion County are urban center points throughout the state. We have a significant rate of providers who are licensed to provide that medication-assisted treatment or MAT. But then when we look down that southeast portion of the state, where we saw that high rates of fatal overdose and non-fatal ED visits, the prevalence of providers who can help address this epidemic are lower, which may lead into other types of grants that you write. So maybe not a direct public health primary care grant, but maybe it's a training grant or a different type of grant to get those providers to practice in those communities. So what were some of the barriers that we have been seeing through the Indiana Rural Health Association and the Indiana Rural Opioid Consortium? Those have been really related around transportation issues, health workforce shortages, the stigma associated with mental health and substance use disorder, and insurance. So we know that a lot of individuals, reliable transportation, especially if they need to go to an urban area for their treatment on a frequent basis, is a great issue. We've talked about the health workforce shortages, stigma. We know that we are still combating and fighting the stigma related to mental health and substance use disorder. We know that people are very open about primary care and physical health needs. I have diabetes, I have COPD, but are very much a shame associated with saying that I have opioid use disorder, I have depression, I have anxiety. And then we also know insurance. This has been improving over time. But we know that there is a big factor here of do individuals have health insurance? And if they do have health insurance, does that health insurance adequately cover the necessary needs for treatment related to medication-assisted treatment or other mental health and behavioral health needs that may coincide with that. So at the Indiana Rural Health Association, we put together a five-part model um, related to this. So we know that care coordination is needed. We know that primary care is needed. Mental health is needed. Pharmaceutical supports are needed. And the community needs to wrap around these individuals, both the individual with a substance use and opioid use disorder, as well as their natural supports and their primary family members who are supporting them and ensuring their adherence to treatment. And you see off to the side where different funding mechanisms that we have had over time have helped address these different components within our model. So the Indiana Rural Opioid Consortium, or INROC, was our initial funding. It is sunsetting in September. It started 3 years ago, and it really focused on primary care and mental health. That led us to our initial RCORE planning funding that Ali and I were the co-project directors of, that ended September of last year. We also identified that mental health needs and telebehavioral health needs were strong, so we applied for and received the Crossroads Partnership for Telehealth to provide telebehavioral health services throughout rural Indiana. And now we're talking about the Indiana Rural Opioid Consortium, or INROC's RCORE funding that's related to implementation, and really that's focusing on the community and the resources of that community to, again, come around that family who are supporting individuals with a substance use disorder. So the INROC Rural Opioid Consortium Implementation Grant, it's a mouthful, but as we get into grant writing, our titles are specific. This is a 3-year grant funded through IRHA. It's a collaboration with key stakeholders among 14 geographically and culturally disparate populations throughout the state of Indiana, whose core purpose is to reduce both morbidity, death, and mortality, incidence and prevalence of disease associated with SUD and OUD. So we've broadened it not just on opioids, through prevention, treatment, and recovery. The mission is to promote and increase access to treatment for opioid use disorder, human immunodeficiency virus, or HIV, and hepatitis C, or Hep C, in rural Indiana through evidence-based practices for increased community outreach, workforce capacity, and recovery support. We have several partners on this grant, several of which are on the call today. We want to give a shout out to everyone because this work cannot be done by IRHA alone. We have several state level partners: Indiana University, Indiana Hospital Association, and the AGRA Institute. We also have several clinical partners: Reed Health, Indiana University Health, Harrison County Hospital, Gibson General Hospital, the Indiana Health Centers, Beacon Health System. And then we also have several specific. So we do have the Boone County Sheriff's Department involved from a law enforcement perspective, as well as the Hometown Media Group from a media and outreach perspective. And all these partners have come together to focus on this mission of how do we reduce the incidence and the prevalence of SUD and OUD. So with that, I'm going to go ahead and transition now into a little bit about grant writing. But before we can get to grant writing, the first question I have is strategic planning. What are the strategic needs of your community as you start thinking about grant writing? There are a lot of federal dollars, more federal dollars than we've ever seen before for one specific issue in such a short period of time related to SUD and OUD. And it can get very overwhelming very quickly as all these grants become available and you're trying to decide which grants that you want to pursue. So you really need to do strategic planning or strategic thinking as an organization, as a community, or whatever unit you are, to say, what are the needs of the community that we are trying to address, and how do we do those? Are they specific to substance use? So is it that we have a high rate of deaths, so we need to have a syringe services program? We need to have increased access to naloxone. We need to have education in the high schools, education in the community on the stigma and the signs and symptoms of SUD and OUD? Or are there other issues that you need to address that are more broad than substance use, but play a counter into substance use, like transportation, like insurance, like healthcare service delivery? These can be built off of a China, or which is a community health needs assessment that your local health department and your local hospital do every 3 years, or other activities. Maybe this is a half-day retreat of key stakeholders in your community to identify what are the needs. Maybe this is doing specific sampling of individuals with an SUD or with an OUD diagnosis of what were the barriers that you perceived, or what were the barriers that you had, not necessarily perceived, that you had that prevented you from having access to treatment. What did you wish our community would have done differently for you? Then you can say, okay, these are the needs. It's transportation, it's insurance, and it's providers. Now, when I look at a grant, I can say, does this grant help address the need that's been identified, or does it go down a rabbit hole that we don't have the capacity to go down and support while we're focusing on these? So what grants are you looking for? Once you're able to identify that, then you can start looking at grants, and you can get into the grant anatomy related to that grant. Any grant, when it comes out, releases a document that we either call as a NOFA or an RFP. So NOFA is a Notice of Funding Opportunity. An RFP is a Request for Proposal. I've taken a screenshot of one from HRSA, the Health Resources and Services Administration, Federal Office of Rural Health Policy, Community-Based Division, for the Rural Health Network Development Program that was due back in November of last year. I'll be using the word NOFO throughout this presentation, but this is what I'm talking about. When a grant comes out, your NOFO is like the Bible of that grant. It will lay out all the components that you need to have a successful application, and it will give you hints of what is the funder looking for. What does the funder want you to have? What does the funder require you to have? If you don't meet the requirements that the funder says you must have, do not waste your time and focus and write that grant. Focus instead on other components or other grants that you want. If they want to have, then you know how to strategically align your organization's initiatives and other partners. So what are the components of a grant? We're going to go through each one of these. I have a slide per each one of these, but I just want to give you a quick snapshot of where we're going to go. So the first thing is the eligibility of that grant. Who is eligible to apply for that grant, and what do they need? Secondly, what is the purpose of the grant? What do the funders want to achieve by giving out this funds? And then as you write your grant, what is the need that your community has that you're trying to fulfill? What is the methodology and the work plan that you're trying to create that will fill that need? What challenges do you expect, and how will you overcome them? Who are you? What organization are you? How are you going to prove to the funder that you use the money appropriately, wisely, and receive the outcome you want? And how much money do you need to do all those activities listed? So let's dive into each one of these. As I go through these, please drop in the chat if you have questions, or there's other areas during our Q&A at the end that you want us to come back to and have further discussion around. So first off is eligibility. For the eligibility, I took a screenshot of that NOFA for that network development program at the very beginning. Every grant is going to have an eligibility, and some of those are as basic as what kind of organizations can apply. Some, it can only be a 501c3. Some can only be state government or local government. Others must be an educational institution. Others yet must be a church or synagogue of some kind. So you need to look and say, okay, what kind of organizations can apply? Can my facility, my hospital, my local health department, my nonprofit, are we even eligible to apply? If not, and this funding is really important to me, then you need to identify the people in your community who can apply and say, will you partner with us on this application and lead it on behalf of our community? Secondly, what are the geographic requirements? We're the Rural Health Association. There are a lot of definitions. There's over 25 unique definitions of what is rural. A lot of those come from funders because every funder thinks they can do it better than the other funder. So what is that funder's definition of rural, and do you qualify for rural? So for HRSA, you go to data.hrsa.gov/tools/rural-health, and there's a portal there that you can plug in county and or address to say, am I rural? If you're not rural, then you can't apply for the rural grant. And always check this. Just because you're like, oh, I'm always rural. We have critical access hospitals in our state that are not defined as rural by HRSA. So always double check it. As the census is starting to unfold in 2020, this will be updated. So just because, oh, we've always been rural, every application, you should always check this. And then lastly, on eligibility, you need to look at how many partners do I need. Some grants will say you must have 3 unique EINs, which is a tax ID number at an organizational level. It's like your organization's social security number. You have to have 3 unique EINs to be eligible to apply. So you have to partner to apply. Figure those out early, because the last thing you want to do is write a whole grant and go, I need to find partners, and now I have to have a budget for my partners. Figure that out early so you can identify that and work through that. Next, you need to say, what is the purpose of the grant of which you're applying for? So again, I took a screenshot here of the purpose of the grant for the network development program, and it had 5 bullet points: improve access, prepare rural health networks to demonstrate outcomes from a sustainability, utilize an evidence-based or promising practice. This is what the funder wants their money to go towards. This is what they want to be able to say, after this grant, this is what was achieved. So how can you creatively, or maybe it's a direct fit, how do you connect in with what you need? So if it is transportation, that's improving access to healthcare. So how do I figure that out? This also talks about transition to value-based payment. So how do I discuss payments? How do I figure out the need that I have with the purpose of the grant? This says that you have to utilize and or adopt an evidence-based or promising practice model. I have to cite what I'm getting ready to do. This can't be me just coming up with an idea and saying, hey, let's try this. They want me to go to the literature out there through SAMHSA or through other entities to say this is something that's been proven through other grants to work. So figure out that purpose. So now let's say you're eligible. The purpose is right up the alley of what you need. Now we're going to start working on, how am I going to write this? And each of these now moving forward are different sections of a grant that you have to write. Every funder is a little different. For example, HRSA on their needs assessment, they're usually somewhere between 5 and 15 pages. SAMHSA, the needs statement, is capped at 2 pages. So it's very different on the style, how much information to prepare, and what story you're able to tell. So first off, you need to say, what need do you want to address? And do you have the data to support it? Saying that I am a CEO, I'm a community member, I have this perceived need based on this, that does not cut it when you're writing a grant, especially a federal grant. So what out there do you have to prove to show them that you really do need these funds? What quantitative data do you have? My uninsurance rate is X amount. My access to transportation is X amount. My free and reduced lunch in my schools and my community is X amount. Those are quantitative numbers that the reviewer, when they're reading, can say, wow, there's a huge need in this community. What are some leading and lagging indicators based on that you can cite here? So we know that children with adverse childhood experiences, or ACEs, have a high rate of SUD, OUD when they become adults. So if we have a high rate of ACEs, you can connect that, you can make that argument. Here, your job is to be a storyteller. What story do you want to tell? How are you different than those others applying? So if I'm a community in Indiana and I have a huge need for transportation, I can cite data both quantitatively and qualitatively. I can interview some individuals who've had that struggle. I can interview other transportation providers in that community who can identify the unmet need that they know is in their community. And I can weave a very unique story for that reviewer to say, if you don't address this, no one will, and I really need your help because here are all the barriers that are here. So here you're weaving that story. Again, this goes back to your strategic planning. You should know 1, 2, 3, or 4 stories that you want to tell before the NOFAs even come out. I know transportation is an issue. Here's my data. Maybe in a year when that grant for that comes out, you have to update your data, but you already know what that story is quantitatively. You cannot say, I know this is an issue because I live here. That's a great way as a reviewer. When I review grants personally and I see that, I immediately dock points because that doesn't show to me, it doesn't prove to me the science behind the actual need that's there. So once you give that need statement, then you need to move into that methods and that work plan. What are you going to do? So if I'm going to give you $5,000, $10,000, $5 million, doesn't matter. How are you going to use my money to fulfill the need that you just told me that you have, that I believe that you have? What are you going to do? Is it an evidence-based program? Is this something that's worked elsewhere that you want to replicate and reapply in your community? You know, did it work in rural Ohio and it's really successful, so you think it's going to work in rural Indiana and you want to replicate that? You're going to set objectives and goals, and these need to be smart, specific, measurable, attainable, realistic, and time-bound. by June 2023, we will see a 25% reduction in non-fatal emergency department utilizations at the end of this program. I know when, by how much, and what I'm going to measure. So this need to be out there. Then how are you going to do it? Listed on a grant chart. Okay, so I get funding in month 1. I'm going to put together my strategic committee. Month 2, we're going to identify our evidence-based protocol and hire 3 staff. Month 3, we're going to do this, this, and this. Month 4 through 6, we're going to build this. Month 7, we're going to go live and we're going to maintain the program. And we're going to do quality improvement until the end of the program. And then at the end of the program, we're going to do dissemination of our findings. You need to list all that out on a simple chart so the reviewer can say, here's what you're going to do, or the funder can say, here's what you're going to do. That is then kind of your contract when you're funded of, this is what I said I would do. You gave me the funds and now I'm going to do it. This also is where you're going to say who is going to do it and what will they need. This should link to your budget that we're going to talk about in the end. Is this staff that you already have? So a director, a coordinator, a clinician, a nurse? Are these partners out there that you're going to give funds to help do this? So if you're the hospital, am I going to fund the school corporation for an after school program to help deliver the curriculum I want my kids to go through? How are you going to do that? What resources will they need? Are you going to have to go to a conference to get trained? Budget for that. Are you going to go to an all-grantee meeting that's in DC? Budget for that. Are you going to go to other conferences, professional development? Budget for that. Are you going to need iPads for the kids to do different things on, different curriculum? Budget for that. All these should be linking both to your grant chart, what's going to happen, but then also to your budget. And what qualifications do you need? Some grants require a PhD to be involved in the grant to qualify for it. Other grants don't. Maybe you need all clinicians involved. Maybe you need all public health practitioners involved. Maybe you need all teachers involved. Maybe you need a multidisciplinary team. Who is going to be working on the grant and what do they bring to the table? What are the letters after their name? It's important when we get here because that's where you get to tell your story of these are what these people are trained to do and they're going to do that. And then lastly, you need to list out how are you going to sustain this when funding is over. So if I give you 3 years of funding, you got $1 million to go out, do great work. When I pull away, when my funding ends and I quit paying you, I don't want to see a regression back to where you were before the funding. So what are you going to do to sustain it? Well, maybe it is, I'm going to get a provider in, I'm going to offset some of their time so they can learn how to be an MAT provider. But by the end of 3 years, they're going to be billing so much MAT services that you don't need grant funds to support that. They're going to have routine revenue coming in through Medicare, Medicaid, private insurance, self-pay, whatever. Maybe it's a public health initiative and the county is going to pick up the dime on the end. Who is your funder? What are you going to do? Maybe it's your goal is to do proof of concept, and the next thing is you're going to write another grant. And that's in your grant chart is by Q4 of my last year, I'm going to be writing another grant to continue this work at a different level. So a lot goes into your methods and your work plan. We can do a whole webinar, a whole workshop on this, but those are some of the things that you need to consider. Then every grant's going to ask you to do a resolution of challenges. So what do you anticipate? Do your SWOT analysis, your strength, your weakness, your opportunity, and your threats. If your weakness or your threats arise, which we know they most likely are going to, what are you going to do about it? Prove to me as a reviewer, as a funder, that I'm going to give you this money, a challenge is going to pop up and you're not going to crumble like a cheap card table. Okay, show me how you're going to do that. Well, we've had 5 grants. We've had these challenges. Here's how we're going to overcome them. Here's our communication plan to overcome them. Or we anticipate that federal policy will change. Here's our expertise on our committee or on our workforce to ensure that when those changes come, that we'll adapt rapidly to address those. Prove to the reviewer that there will be a challenge. If you say, hey, we will have no challenges, that's naivete. A reviewer's going to dock you on that. And then how's your team going to be able to respond to this? This is not a super long section, but it's a very important section. Don't overlook it. Maybe you're working with several partners and they're not willing to share data halfway through the grant. How are you going to overcome that? Well, we have strategy 2, strategy 3, strategy 4 for our building or for collecting that data. Okay, next we're going to say, who are you? What's your organizational information? And they're going to want to know this in the funder. Who are you? Are you a 501c3? Are you a hospital? What's your size? What's your structure? What's your bylaws? Some grants will require you to submit your bylaws. Some grants will say I'm a CEO, an executive director that is managed by the board. Therefore, the CEO then hires all the staff. This grant will have this director who's in this part of the org chart. Here's the upward reporting structure. Here's how the decisions will be made. Here's who has final fiduciary responsibility. Here's our checks and balances on funds. All those things need to go in there. How will this grant fit within your organization? How do your partners fit? So, our INROC grant right now that IRHA is fortunate to manage with several of our partners, we have 14 unique partners involved in this grant. How do they fit within the grant? What work are they doing? How do they fit budgetarily in the grant? How do we have them report back to us as the manager of that grant to report back to the funder to ensure that work is being done? So all that's going to go in here. If you write a lot of grants, this kind of becomes boilerplate that you just kind of revise specific to that grant, because who you are, your history, and all of that, you can just kind of drop in there, revise it, and move forward. But the first time you're writing a grant, don't overlook this. Don't go, oh, that's easy. That's just stuff that we all know. We'll just write that at the very end. Because for the reviewer, that's the only thing they know. They don't go out to the web and review your minutes of your meetings or look at all the great work or do a web search. They just have to go on what you tell them. And if you don't give them a lot, they're going to go, I'm not sure there's the capacity here to actually do what they're saying they're going to do. Then the last main section of your proposal, we're going to get to the budget next, because that's another big area that you're going to need to focus on, is your evaluation. So you've proven to me that there's a need, that you have the right workforce to do it, you have a plan to do it, you're going to overcome your challenges, and your organization is well structured to do it. Now you need to prove to me that the money was used correctly and that you have outcomes related to what you've done. Some grants are going to say this needs to be a internal evaluation that you do on your own. Other grants are going to require you to go out externally and say you need to have a third party, either a university, another nonprofit, or things like that, that will do that. Or maybe there needs to be a division of the staff of the firewalls. So here at IRHA, for example, we have an evaluation team. They're not involved in the day-to-day components of the grants. All they do is do the evaluation, but they're external to the grant. So do you have that division of staff? Do you have the firewalls essential? What data are you going to be collecting? Is it going to be qualitative data? Are you going to be doing interviews and focus groups and field work like that? And do you have the capacity? Do you have the staff to transcribe those? Do you have the technology appropriate for that? Or are you doing quantitative data? Are you mining EMR data? Are you doing surveys? If so, are they surveys? If so, do you have SurveyMonkey that's allowed to do that? Do you have other things like that? So you have to kind of design that, saying, okay, based on my work plan, here are the things that we're going to measure. Here's our quality improvement we're going to be doing every month, every quarter, every 6 months to ensure the grant stays effective. As you're going through that, do you have the necessary contracting needed? Do you have an institutional review board and an IRB in place? Do you have memorandum of understanding and BAAs related to that? Are you handling HIPAA data? If so, do you have HIPAA trained staff? So as you're looking at getting into these grants, you may go, whoa, I don't even know what some of those acronyms are. There's a lot of grants I want to write for. Well, maybe you contract with someone, you partner with someone and say, hey, will you be our evaluator who've already built all this capacity to support you? And they can kind of come in and help guide you and say, okay, well, we're going to do this survey and that survey and look at this data, and we're going to report at this frequency and help you with that. Or maybe you're big and you're like, hey, I want to build all of that within my organization. Then that team should know all these components, but your reviewer needs to see that. They want to know, A, are we handling things ethically? Are they confident with what they're doing? And then if so, do they have the proper methodologies and techniques in place? And then the last section, I say it's the last section, really this is the section you should start with and you should end with, and you should look at every step of the way, is your budget. So first off, if you have this grand idea and it's going to cost you $1 million to do it, and you're applying for a small $5,000 grant, that's going to be some disconnect. That's going to be an issue. And the grantor is going to say, well, I don't see all that money coming in to do that. So when you're thinking about your budget, do you have the budget? Does the grant allow for you to do the amount of work that you said you're going to do? And on a budget, we split those up into 6 main categories. I can't count. Personnel and fringe is 2, but really 1. So that's the lead agency applying. It's their staff, their capacity. That's the director. That's your business office, things like that. The fringe associated with that. what travel is needed. Okay, are there meetings that you're required to attend out of state? So HRSA, for example, for a lot of grants will have a meeting that you have to attend to every year in DC. You need a budget for that. If your territory is 5 or 6 counties, how often or how frequent do you plan on visiting them? Budget for that. What supplies are you going to need? You know, are you going to need iPads? Are you going to need computers? Are you going to need printing paper? Are you going to need pens and pencils? You know, think through all that, put all there. What other supplies do you need? If you're delivering, let's say, an opioid curriculum for high school kids, are there things that you need? You know, it's an 8-week curriculum. Every week we're providing food. That's a supply that I need. Or a binder for teachers for training that I'm going to have to produce. Who are you partnering with contractually? So, you know, if I'm partnering with an evaluation firm, I need to make sure I budget for that. If I'm partnering with healthcare entities to provide services, I need a budget for that. Or schools, that goes under contractual. And sometimes they'll submit their own mini budget that has all these subcategories with it as well. Who's their personnel? Who's their travel? Who's their supplies? That all rolls up. And then what other expenses do you have? Are there marketing expenses? Are there IRB expenses? Are there rent and securities and things like that? Then the last question is, does your organization require an indirect? If so, that comes right off the top. So if it's a $1 million grant and you have a 20% indirect, that means you have $800,000 to work with because $200K will go right to your facility. If you don't have an indirect, that's fine. You don't need to have an indirect, but just know that. Do you have the necessary audits and controls in place? When you're dealing with, especially with federal grants, do you have audits being done every so often, every year, to show that you're using the funds appropriately? Do you have all those procedures in place? If you're a new organization in the grant world, that's something that's going to take a lot of time to establish. So make sure you know that as you get that first grant, that you're crossing all your T's and dotting all your I's. The beauty of a lot of these things, especially around evaluation and budget and organizational information, is you can be working on this without a grant application going in. You know, okay, if I want a federal grant, here are the things that we're going to have to be able to do eventually. Let's start knocking those out. So when the grant that I want to apply for comes out, I'm able to submit that right away. Okay, well, thank you for sticking with me so far. So let's go ahead and transition to how do we find the grant opportunities. So where to start? So really, we're going to look at 4 unique spots: federal, state, local, and make your own. On that, again, each one of these subheadings could be a whole hour discussion. So we're going to go through these kind of quick, but again, that Q&A is a great opportunity for you to ask those questions and for us to be able to help support that. So I talked a lot about federal grants. So I put here, know the alphabet soup, and I put a lot of initials here, and you're probably going, whoa, what is all of this? So the first part is the grants have a convenience comes to federal grants on grants.gov. It's a singular website that all federal grants and contracts can be applied for, cooperative agreements, not contracts, cooperative agreements and grants. It is relatively easy to use compared to what it used to be, but it is still very complex. If you're new to grants and your organization does not have a grants.gov account, that's the first place to start. And again, if you have any help, we're going to have a slide at the end that IRHA can help, how we can help. But again, reach out to us. We'll be more than happy to kind of talk you through how that works. But where the funding comes from is unique. So I have the alphabet soup here, and these are just the ones that I quickly think of that may have grants that you're interested in. So SAMHSA is the Substance Abuse Mental Health Services Administration. HRSA is the Health Resources and Services Administration. NIH is the National Institute of Health. DOJ is the Department of Justice. AHRQ is the Agency for Health Research and Quality. PCORI is the Patient-Centered Outcome Research Institute. ACL is the Administration of Community Living. And USDA is the United States Department of Agriculture. All of these groups in the last 30 days have released at least one grant that I could say would relate to the rural substance use response in communities in Indiana. There's a lot there to keep track of and to follow. SAMHSA is very focused on the reduction, prevention of substance use disorder, and the treatment of substance use disorder. HRSA is very focused on the access to treatment and the quality of that treatment. NIH is very interested in the research of what is causing this epidemic. DOJ, or the Department of Justice, is very interested in the criminal aspects and how do we set up drug courts and other components of the response from a criminal and justice perspective. AHRQ is very interested in the delivery of care and how do we improve care delivery. PCORI is very interested in patient-centeredness and what do patients need and want to help support their growth. ACL is very interested in how do we keep people living in the community in which they want to live in. USDA is very interested in promoting agriculture and the health of rural. Right now, there's a lot of focuses on telehealth and other grant initiatives to support the expansion of capital throughout your community. So you can go to grants.gov or to any of these agencies directly and search for these grants. There's a search window. You can subscribe to them. My best bet is go to the agencies, join their listservs, and get 100 emails a day. And I'm kind of joking, but I'm also not. On days when grants come out, you get a lot of emails. And that's the best way to stay current. So identify that one person on your staff to say, help me understand these grants. Help follow these grants. When the grants come out, notify us and support that. I'm sure there's other federal agencies that I'm not even thinking about. DOD is doing some work right now. Department of Defense, is doing some work on opioid use treatment, especially as active duty tend to live disproportionately in rural. So that's a unique funding mechanism as well. So again, I encourage you, all of them will have NOFOs, RFPs that will have the same main areas: needs, methodology, evaluation, organizational. So I encourage you to look at that and to support that. Next is state-based grants. So again, we're focusing only on Indiana. The three main agencies within our state that I would encourage you to look at is ISDH, the Indiana State Department of Health; FSSA, which is the Family and Social Services Administration; and then OCRA, which is the Office of Community and Rural Affairs within the Lieutenant Governor's Office. All three of these have different funding mechanisms to support them. I have a screenshot here, the FSSA site. So if you just Google FSSA DMHA, Division of Mental Health and Addiction funding, that'll be the first thing you find. They release their RFPs. They call them RFPs here by year, so you can keep following that. Also, they have a listserv, so support. You see that, stay informed. Click here to sign up for addiction treatment services and supports email updates. The emails come out, so you don't have to check the website every so often. Follow those emails and be able to support that. ISDH likewise has emails to do that. OCRA does as well. So I encourage you to look at all of those. Again, these go, so you can see here that we have youth mental health first aid. So how do we get mental health first aid for our youth? So on and so forth. The next is local grants. Again, this gets even more granular, that it's hard for me to really speak to what is in your community. But just some ones that I would encourage you to look at is your community's foundation. Every community has a foundation. They give out grants of varying sizes. They have different procedures and policies to achieve those grants. Some are rolling. Sometimes they're once a year, things like that. Look at that, prepare for that, understand those. You can also reach out to local business foundations. So you have a large employer in your community. They tend to have foundations. So like SIA in Tippecanoe County has a foundation that they give back to their communities that you can apply for different initiatives. Your hospital may have a foundation, especially if you're a member of a big system hospital. So Ascension, IU Health, St. Francis all have foundations that you can apply for. Also, don't forget city and county government. Your local health department, your county government, your county commissioners, they may have funds that you're able to petition them for and say, hey, this is a huge need for, maybe it's a syringe services program that we need support for. Go to your county commissioners and say, is there excess funds and other budgets that you can pull back and give a grant out to support these efforts? Again, you know your communities a lot better than I will ever know your communities. So you're going to know kind of where to look at, who to ask for, who to talk to, who are the key members there. Maybe it's your local bank. A lot of banks give backs, so you can petition them. And that kind of leads me to this make your own grant. You know, kind of think about develop your own proposals and shop it around. If you know that there's a huge need for transportation in your community and it's affecting the workforce in your community, develop a proposal, put together a budget, an evaluation plan, and go to the large employers, go to the Chamber of Commerce, go to the county and say, hey, we know this is an issue. Here are evidence-based strategies that we can utilize to support these efforts. Even though they don't have an RFP out or things like that, and say, hey, can you free up X amount of dollars to support these efforts? You can also go to the state and say, this is what I need. Go to your state representative, go to your state senator. They can include those in their budgetary requests, you know, as block granting from the state to some local entity who can give you those funds. Local and state-based foundations, you know, they usually don't say, hey, call us when you know, call us every 3 months and things like that. They want people to kind of call them and help them support that. So make your own grant, identify those needs. Again, we're circling all the way back to the beginning of your strategic plan. Support your strategic plan and identify those needs and create those and have those ready to go. The nice thing is when you have those ready to go and you're shopping those around, when an RFP or NOFA comes out from the feds that matches that, you've already done a lot of the legwork. Now you just got to convert it into what the feds want. Excuse me, and the format that they need. So I know that was a lot of information over the lunch hour, but I just want to say IRHA is here to help. Don't think that we're just like it's a one-time and done. So no, reach out to anyone on this last slide that we're going to show here in a second. We'll have my contact information. IRHA is here to help with strategic planning and grant identification. We've led strategic plans around grants and help communities identify that. And support them. We do support with the proposal writing. If you're like, hey, I don't even know where to begin, contact us. Let us know so we can help you with that. We have our own research and evaluation department in-house. If you're like, hey, I don't want to think about that, but I trust IRHA, reach out to us. Or if you're like, hey, I don't even know, we need help in our community. We kind of need someone to just kind of run with everything, but we want to be good partners with them, with grants management and all these. Again, reach out to us. Again, we're here to help you. There's a lot here. IRHA has a lot of experience in grant writing, grant management, evaluations, and all of that. This is kind of one of our strengths, not kind of, this is a strength of IRHA. So don't hesitate to reach out to us, have a conversation with us. Love to get on Zoom and have a one-on-one, learn more about your community, learn more specifically about your needs. So with that, I'm going to open it up for questions. My contact information is here. I got my email. That's the best way to reach me is via email. Email me if you have any questions, anything like that. With that, I'll turn it over to Allie to help facilitate the Q&A, both within the chat and the Q&A module that is open.
Thank you so much, Cody. Excellent presentation. I don't currently have any questions in the queue, but as Cody said, please feel free, if you do have any, to go ahead and submit those. You can use the Q&A function or the chat. You should be able to find either of those if you're not aware by hovering over the screen. Depending on which view you are in, they will either pop up at the bottom or the top of the screen. We'll go ahead and give it just another minute or two and see if anybody has any questions they'd like to ask. Okay, well, seeing none, Cody, we really appreciate your time today. Again, this has been recorded. We will be sharing it to our YouTube channel after it is done processing. So thank you, everyone, and have a wonderful afternoon.